This will be an overview video on the treatment principles, okay, that are involved in tetanus. That's like basically your aims. If you are trying to treat a patient that has tetanus, what are the things you are aiming at? Okay, what are the things you are aiming to correct? Okay, so overview of treatment principles for tetanus. Overview is more of like we just list them, we just talk about a bit about them, because each of those principles will be taking our time to make videos on them. So treatment principles for tetanus. These are the symptoms which will be coming back because we are not primarily here for the symptoms of tetanus, just to actually talk about what overview principles. First of all, you have to look at the general measures. Now, under the general measures, you are trying to look at how can you be able to what? Control breathing. How can you be able to maintain the airways of this person? Because breathing is what? Important. If the patient can't breathe well, then they'll basically pass out, right? Then the next principle, you are trying to look at what? Neutralization of the circulating toxins. You know, there are some toxins, that is tetanus toxins, that are circulating, and some of them are bound, some of them are unbound. Now, the unbound ones are the ones that are trying to neutralize. Now, in neutralizing this, you might want to administer things like immunoglobulin. You might want to administer tetanus toxoid. Okay, so these two medications will basically help to tackle any possible problems. All right, then you also prevent further toxin production. That one, so the medication is there. We'll talk about it. Then you also look forward to trying to what? Control the muscle spasms. All right, because one of the classical signs of tetanus is what? Muscle spasms. Okay, from this you can also have aching of the back. All right, so you want to control all this. All right, so talking about the symptoms again, you can have fever when you have tetanus, high blood pressure, muscle spasms, lockjaw. Lockjaw is you having problems trying to lock your jaw again. Your jaw can be permanently open. All right, then you can be sweating profusely and there'll be difficulty swallowing. This is because the muscles are kind of like getting degenerated. Okay, so that's it about what the treatment principles. That's basically things you are looking forward to tackle if you are treating a patient that has tetanus. All right.